Dr. Dixon, Alexis with ABC6. Thanks so much for answering questions today. First question is, have you received the open letter from the Columbus Education Association? Are you aware of this? And in that letter, it's requesting for a 2-week pause, 2 weeks to go remote. Is that something that you are considering?
Hi, Alexis. So first, I just say that the district appreciates all the work of our employees throughout the pandemic, and they're willing to be flexible to serve our students. We know that in-person learning is the best and the safest place for our students, and we will continue to make sure that we're learning in person as much as possible. We will continue, as Dr. Bodie just stated, to make sure that we're implementing the mitigation strategies. Our mask, we've been masked since the pandemic started. We have not let go of, we've not said our students should not mask. It is a policy. So we make sure that all of our students and our staff are masked. We're social distancing where possible. We're washing our hands. We are making sure that we're providing the safest environments for our students throughout this pandemic. And we will continue to do so. But we want our students in class as much as possible because that is the best and safest place for them to learn.
Next question.
Hi, Dr. Dixon. It's Eric with NBC4. Thank you for taking the
Eric.
time this afternoon. We have heard from some saying that in some areas, the social distancing, all the measures that were being taken, say per se last spring, like when it comes to the barriers and the stickers on some of the walls, aren't being taken as seriously now and aren't available in some areas. What would you say to address those concerns?
I would state again that we have the mitigation strategies that we have in place are working. And we have heard from our health officials that we should continue with those mitigation strategies, social distancing, hand washing, and make sure our students and staff are masks. And we are following those guidelines from our health officials, and we will continue. So if there are some concerns, those staff members should definitely alert their principals. If there's some other PPE that they definitely need, there is a venue. I mean, there's a process in which they can request those additional resources if needed. But we are, again, masking up, we're washing our hands, we're social distancing where possible, and we are and our staff members are very vigilant about making sure that we're following those mitigation strategies.
Hi, next question, please.
Hi, Haley Colombo from Columbus Business First. Hi. So I guess the current strategy of some days, some schools being remote due to staffing shortages, that kind of thing. In the letter from, the Columbus Education Association, they said that everyone knows that is unsustainable. What is your response to that? Like, I think some of the proponents of going remote are saying that these like last minute closures are proof that everyone should go remote. What would your response to that be?
Well, again, I say that, I appreciate all the work of all of our employees through this pandemic. Their willingness to be flexible, to serve our students. And that's what we must keep in mind, that in-person learning is the best model for our students, right? We understand that there are a number of absences that are happening. There are some staff members that may be sick due to the flu, other illnesses, COVID, et cetera. And so we're looking at those numbers. I mean, we're looking at the number of absences, the type of absences. We're looking at them in the evening, looking at them in the morning. We're talking to our union leaders, and we're looking at that data and making sure that we can have enough staff as possible to safely open our schools for in-person learning. And where we don't have staff members, then we move those schools to remote learning. But, you know, we don't know exactly when it happens, right? Sometimes we get the notifications in the afternoon and the evening. Sometimes we get the notification in the morning. And so we know that, you know, a staff member may wake up in the morning not feeling their best, and they put those notifications in at that time. So, you know, flexibility is a key here. We want to make sure we're flexible with our staff and getting those notifications. But we try to notify families as early as possible. I mean, we're up as early as 5 in the morning. So we are trying to make sure that we're notifying parents as early as possible, and we appreciate their flexibility, though we recognize it is not ideal. But we are working hard to make sure that we notify our parents as soon as possible.
Next question, please.
Abby Meyer with 10 TV. I think, you know, one of the main problems right now, district-wide, county-wide, even statewide, people are struggling to get testing. So, you know, when you talk about mitigation, have you run into that problem to get tests to these families, or have you kind of just made a decision where if you can't get a test, don't come in? Can you kind of walk us through what it's been like to get those tests?
I can answer a little bit of that, just serving in that health services capacity. We've been fortunate to have a great continued partnership with the Ohio Department of Health to get those rapid at-home testing kits to serve our students and staff. So we've been able to distribute those to all of our buildings and make them accessible. So if we have students that come to school and then are starting to feel sick while they're there, and so they're getting picked up to get that isolation and test, they're getting sent home with that kit in their hands. Or if a family is needing to come and pick that up, then there's opportunities for them to do that. So we have been fortunate to be able to allow us to be a resource for that. So families aren't desperately calling around or going to different locations to try to find that. So that really has been another big part of our mitigation strategy, is the availability to have that rapid, quick testing so we can know which students are out with COVID and which ones not.
And to add to that, we also have those rapid tests available for our staffs. So we do each week, if our principals need those tests, we are sending those tests to their school sites. So we are making sure, as Dr. Bodie stated, that we're being responsive to our staff as well as to our students and their families when it comes to having access to tests. And also making sure that vaccination clinics, right? So we, Dr. Bodie, want to speak to that, of our clinics that we've had?
Yeah, so we've been also fortunate to be able to offer up vaccine clinic opportunities right in the schools, so each of the school buildings. So for example, most recently, we targeted the elementary school buildings as the vaccine became available for the 5 to 11-year-olds. And through a central process, we were able to partner between Nationwide Children's and Columbus Public Health to go to every single elementary school and offer the opportunity to get both doses of the Pfizer vaccine. And we had just under 2,500 students take us up on that offering. Some of the students had already gotten it, you know, families had taken them to an outside location, but that was just, again, another great mitigation strategy as we get the vaccine rate up in our community. And Franklin County actually is, they were just above 60% who had started the vaccine process. And they're one of the counties that has the highest rates in the state of Ohio across the board. So again, this is really good news for us in Franklin County as we continue to try to get the COVID surge under control.
Next question, please.
Hi, it's Megan with the dispatch again. Thanks again for taking time to do this. I wanted to kind of circle back to the letter from the union that was brought up earlier. It listed demands, including securing and distributing proper masks, deep cleaning buildings, and potentially making repairs to the HVAC systems that are not working. I was just curious on the district's response to those demands in particular, and if the district is looking into purchasing more masks, deep cleaning the buildings, and making repairs to the HVAC systems.
Thank you, Megan. So we will continue to provide the PPE that school buildings need. Just a few weeks ago, for example, we delivered 45,000 KN95 and KN90 masks to our staff that needed them. So masks are available, sanitizers, we're cleaning our buildings, our custodial staff, everyone is doing their part to ensure that we can bring staff and students back in safely. If there are some HVAC issues, we're addressing those issues. You know, we've had some cold days here, and some of our buildings are old and some of them may need refreshing, and we have addressed those, and we would continue to address those concerns when it comes to HVAC issues. But again, we can't have students if we don't have our staff, and it is important that we have our staff in, and our staff want to be here. They want to be teaching with our students. They want to do it safely, and that is important that we have the PPE. We're following the mitigation strategies for our students and for our staff so that we can continue to safely bring our students back to school where in-person learning is best and safest.
We have about 15 minutes left in the window. Are there any other questions?
Again, Dr.
I have another
Dixon,
quote.
I just want to do a quick follow-up with my question from earlier, just to clarify. Have you received the Columbus Education Association open letter? Is that something you received today, and have you read it?
The district has received the letter. The communications team has received the letter.
So just to clarify, we have not received any kind of hard copy. I just received the link that you sent me, Alexis, regarding the open letter. That's the extent of what we've received here at the building.
Yeah,
Great,
thank you.
Thank you.
And a follow-up to that question, the focal point of that letter is requesting a move for the entire district to go to remote learning. Is that something the district is considering?
As I stated before it, the district appreciates the work of all our employees throughout the pandemic and a willingness to be flexible to serve our students. We're committed to in-person learning as much as possible. It is the safest place for our students, and that's where we're committed to that. We're committed to in-person learning. We're committed to making sure that we have all our necessary PPE. Our mitigation strategies are in place. We're following the direction of our medical experts. Our public safety expert, our medical experts, Dr. Mashika Roberts. We're making sure that we're following her guidance. And we have Dr. Sarah Bodie as part of our team too. So we have experts that are helping us and to make sure that we have the proper mitigation strategies. We're looking at our data. We're not making these decisions in isolation. And that is important. It's important that we bring students back in safely. It's important that we have our staff that are teaching in safe environments. And it is important that we have a commitment to this Columbus community and to the families that we are teaching in person as much as possible. And we're going to continue to do that and do that safely and continue to be flexible when needed. So if we have to pivot and move schools to remote learning, it is because there may be a staffing issue, and we understand that. And we want to make sure that our teachers are healthy. Their health is important to us too. That's why we recognize that some of the issues, staffing issues, may be related to COVID. It may be related to the flu or other health issues during this pandemic, but we are committed to in-person learning. It is the best and the safest environment for our students.
Hi, Dr. Dixon. This is Tanisha.
Hi, Tanisha.
Hi. Just curious, is there a message for staff beyond that you appreciate their work? And I'm asking this question because it could potentially come across, and this is just my perspective, that while you said, okay, we are committed to in-person learning and we're following the experts, that their request is kind of being ignored. So versus, in terms of their demands, that's what I'm saying. So I'm just curious, is there a message, for them? Yes, you've gotten this letter, but what would you say to them since they've asked for a pause?
Well, one, I've not received a letter. I think you heard from Jacqueline that there was a link that was sent, I think she said from Alexis. So I've not received a letter. But what I will say to our staff is that I understand we're in a pandemic, right? And what is happening to Columbus is not unique to Columbus. It is happening all over the United States. School districts want their students to be learning in person as much as possible, right? So I understand that as a leader, and I think all of you understand that, right? So what we have to do is make sure that we can do it safely, right? And with those staff members who are able to come to work, right? Because we don't want staff members to come if they have COVID. We don't want staff members to come if they have the flu or other health issues. We understand that. So I think the message is that we appreciate the staff of Columbus City Schools for stepping up to ensure that our students are learning in person as much as possible. We appreciate our transportation drivers who are, we have drivers that are driving multiple routes because we know there's a national shortage of bus drivers, but they want to make sure that their students are in. Thank you to our food service workers. We had just a couple days ago, we had a shortage of food service workers, and we had team members that pitched in to make sure that our students had a hot, healthy meal. Thank you to our medical team who are partnering with us to make sure that we have tests and that is important, that we have access to tests, we have access to vaccines. And thank you to our many partners who are reaching out to make sure that our students have places to learn after school and on the weekends. So we just implemented last Saturday, we started our Pathway Express, where we had 1,000 students able to go to COSI, right, where the learning continues, and that would happen the rest of this month. Next month, we're paying for families to go to Columbus Museum of Arts. So I think the message is our students deserve to be in school as much as possible. Columbus City Schools can't do it alone. We thank you. We thank our partners for helping. We want to continue as much as possible that continuum of learning in person, and we will continue to do it safely. And I appreciate all of those who've continued to work with us until we see something different with this pandemic. But we have to make sure our students are in the classroom. So I think that is the message that I want everyone here, to take away, that we're going to continue to do this together. We're going to get through this, and we're going to get through it together.
Dr. Dixon, follow-up from Columbus Business First. So it sounds like your point here is that you think obviously there's been a lot of disruption with these closures that sometimes happen on somewhat suddenly based on when you get this information. It sounds like on your perspective, this seemingly very disruptive reality is less disruptive than going remote. Is that your perspective?
You just hit it. Yes. When you think about, we have over 100 schools on an average that are in person. That is saying that schools should be open, right? Learning in the classroom is best. And yes, we will have some times where we have to move schools to remote learning. It's not ideal. However, remote learning now is very different from what it was when we back in March of 2020. We've learned a lot and we've improved it. But we also learned that students need that social interaction. That is so important. Even adults need that social interaction. And so when we think about our students coming back and seeing their teachers and seeing their friends and be able to have that social component is so important, even during a pandemic, even with our mask and talking to our friends, even social distance and talking to our friends, that social interaction is so important. So you're spot on, and thank you for framing it that way. It is more important that our students are in class, and yes, we will have some minor disruptions, we'll probably continue to have other disruptions, but it is more important that our students are in class in person every day as safely and as best as possible.
All right, thank you, Dr. Dixon. It's 2:43. I think we have time for one more question. If there is one more question, otherwise I'm going to wrap it up.
I do have
We've
one.
got another question. Oh,
Sorry,
I'll go
Abby.
and then we'll
was
go
first.
Eric.
Awesome, thank you. So just really quick, Abby with Tin TV here. I was just wondering if you could clearly outline, is there a sense like a threshold that you guys reach when coming up with the decision to go remote for a school? I know in the past we have heard that it depends on the situation, but if you guys could kind of just outline what are the 3 things that you look at, what are some thresholds you look at to make that decision?
Yeah, that's a good question, Abby, but it's really day by day, right? It depends on the size of a building, right? So you may have a building with 300 students, for example, versus one with 900 students. So the staffing is different for those buildings. So it's really case by case. We work with the building principals and the area superintendents, and we are looking at it case by case. So there's no magic number. I know people have been asking, what is the threshold? There's no magic number because it really varies building by building. What we try to make sure is, as much as possible, we have a teacher in front of each student. That is important. And if we cannot have a teacher in front of each student, then we, or in some sense, we have a substitute, long-term building subs. But again, each building has unique needs. And because of those unique needs, we have to determine those in a very different way. So it's not a one size fits all. And I know that's not what you want, that's not what many people want to hear, but it's looking at that data daily. Every day we're looking at that data for that particular building, and making sure that we can staff that building appropriately for in-person learning.
Thanks, Abby. Eric, do you want to have the final question?
if you don't mind, thank you. And Dr. Dixon, thanks again for the time this afternoon. Last week, you had mentioned that there was a lot of staff from the central office out helping at the different schools in order to help keep those schools open and in-person learning, but that wasn't sustainable.
Right.
Do you have an update on kind of where that situation is?
Yeah, so this week we've only had to do that at one school because it was we just had a late notification. But as much as possible, so we don't want to use our additional staff unless it's a late call off. So for example, if the night before we see that one specific school maybe on what we call a watch list, they have enough staff members to open, but if they, for some reason, a couple staff members may call off the next morning and it's too late, then we will send some instructional staff members to help them. But it's not sustainable in the sense that, because we want that student's teacher to be there, right? Because we want to be able to make sure that we have that continuity of that curriculum being taught. And we just don't want students sitting in a classroom and not learning and not continuing, have a continuation of the learning happening that their teacher was implementing. But we do have certified teachers who are ready, staff members who are ready to go. Many of our administrators still have their teacher certification, as do I. So if there's ever a time that a building says that they need someone to come in, I am certified. I can go in and help in some classrooms too. Probably not the elementary classrooms, but would definitely help out in middle and high schools.
All right. Thank you, Dr. Dixon, and I want to thank everybody.